Factors of stress. Generally, there are considered to be two basic types of stress factors: physical and psychological. The physical factors are real and involve the actual dive. Included in this category are the factors related to the physics of diving, such as the absence of weight, cold, narcosis, poor visibility, loss of dexterity, and so on. There are also those linked to how the dive evolves: a mask that floods continuously, seasickness, waves and currents, limited diving abilities, the sense of the sound being muffled due to wearing a hood, assumption of medication, inadequate nourishment, and such like. The psychological factors may be external, meaning caused by problems unrelated to diving, or maybe concerns about the dive itself. Problems concerning the dive arise when you do not feel prepared for the type of dive planned, are afraid of dangers, feel unsure of what you have to do, or are pressured by more experienced divers. Stress is a cunning enemy. It is not easy to recognize if a diver is suffering from stress, and if they are, to what degree. It is not possible to eliminate stress from diving, but you can learn to recognize and deal with it in yourself and in your dive buddies. Stress shows itself through unusual external behavior or signs, and through internal sensations or symptoms felt by the subject. Signs can be recognized by unusual behavior, frequently touching hair, repeatedly touching some part of the body, biting nails, biting lips, fiddling with something, introversion, irritability and short temper, passive reaction to events, continuous delay in preparation, repeated mistakes with equipment, forgetting a lot of things, attitude that disregards danger, breathes out all at once and almost continuously, wide-eyed with dilated pupils, uncoordinated movements, excessive talkativeness or unjustified hilarity, fixation with equipment problems. Symptoms can only be felt by the subject affected and may be: sense of feeling generally unwell, sense of fatigue, headache, cramps, muscular pain, gastrointestinal problems, heartburn, palpitations, tachycardia, increase in blood pressure, insomnia, irritability and short temper, passive reaction to events, forgetfulness and difficulty in expressing oneself, difficulty in completing some tasks, incapable of coordinated action, indecision, closed mind to other solutions, feeling unable to deal with the tasks required, breathlessness. When observing the behavior of the other divers, you have to consider that what may be atypical behavior for one diver may be completely normal for another. The various ways of acting that can be an indication of stress can therefore easily be confused with simple displays of that person's personal character. As well as developing your skills of observation, you must also know how to communicate with others so as to assess the meaning of their suspicious behavior.